Amazon. It's a place that we all know. Pretty much all of us use in one form or another. And when it comes right down to it, they're very good at getting us what we need in usually a good amount of time. However, when it comes to their business dealings and how they treat their workers, they're not exactly above board on certain matters. To the extent that now they're apparently going into the healthcare business. And many feel that they could well and truly go and disrupt the whole system just so they could grow their own massive profits. So, allow us to show you how Amazon could disrupt healthcare. Healthcare. Healthcare offers the challenge and opportunity that big tech companies relish. It's an industry as profitable as it is antiquated. Amazon is one of the tech giants making major inroads in healthcare, and the company is using a multi-pronged approach to transform the industry. Though each new move has generated headlines, disruption in healthcare doesn't happen overnight. But the company's latest foray may be its most tangible and potentially transformative. According to recent reports, Amazon plans to dramatically scale up its direct care delivery service, Amazon Care. Originally available to its own employees and then in select test markets, the program will soon launch in 20 new major cities, including Philadelphia, Boston, and Chicago. The ambitious program seeks to introduce a new patient experience and eventually hire a lot of doctors. So, what will this mean for physicians and patients? And will doctors and healthcare systems have to change how they practice to meet new patient demands created by Amazon? We'll break it down for you. Amazon Prime. Healthcare? At first blush, Amazon appears to get its might from its status as the world's largest online retailer. But these days, it is ultimately a massive logistics, cloud technology, and analytics company. Those capabilities perpetuate its retail dominance and also give it the potential to revolutionize other industries. The Amazon Prime delivery trucks that crawl across the country are one example. Bypassing the old middleman of shipping, Amazon gives Prime members precisely what they want as soon as possible. Those subscribers can also watch exclusive content and get special discounted prices, all while Amazon's huge data operation churns out more personalized recommendations and learns how to route shipments more quickly. The same principles that underpin Prime could be transformative for healthcare. The company's expertise in speed, consumer loyalty, and scalability could make Amazon Care a beacon for lightning-fast care delivered directly to the people's homes. Writing for Healthcare IT News, digital health expert Patty Padmanabhan likened the program to Amazon Prime same-day delivery on steroids. Telehealth is a growing sector due to its convenience and the pandemic. But Amazon Care promises far more than one-off visits with remote physicians. Sure, it offers to connect members with a clinician within 60 seconds of their request, day or night. But it ups the ante by also offering patients a full-fledged, at-home care experience from locally licensed physicians and nurses. Amazon Care will deploy those workers through Care Medical, a legally distinct but Amazon-owned medical practice that first served its employees in Washington state before applying for licenses in 17 additional states earlier this year. The aim is reportedly to have Amazon Care services in 20 new markets by the end of 2022, and many even sooner. Starting small, getting bigger. You'll continue to see familiar faces when you visit with us for your ongoing care, the Amazon Care site says, portraying an effort to provide the personalized, holistic care team that patients cherish. Patients can receive tests, diagnosis, and treatments from real providers without the drive to their physician's office or hospital, rendering those the middlemen in this case. For doctors, the future of medicine may actually be a return to the house calls of the past. Right now, the program is aimed at employers as a cutting-edge, cost-controlled benefits offering. In the new work-from-home world, Padmanabhan believes the new direct delivery model may be more appealing to companies and workers, which, on a certain level, you can see what they're going for here. If they bring the healthcare you need to you instead of you going to a hospital and wait for care, doesn't that sound better? The big picture. Neither telehealth nor home visits are new, and many traditional providers offer both. But no healthcare provider possesses the sprawling resources and scalability that Amazon brings. And that's before mentioning its numerous other healthcare projects and collaborations. Remote patient monitoring will be a key part of the new care at home ecosystem. And Amazon already has technology prowess and ongoing projects that could make it a major player there too. Its Alexa voice assistant boasts a growing repertoire of healthcare applications. And last year saw the release of the Amazon Halo, the company's own fitness tracker and accompanying application. As for prescriptions, Amazon already has those covered. In 2018, it bought PillPack, a novel company that delivers prescriptions to patients' doorsteps in individually packaged doses with clear instructions to encourage proper medication adherence. In 2020, Amazon launched Amazon Pharmacy, uniting its newfound pharmaceutical distribution capabilities with the membership loyalty benefits of Prime. Driving this new Amazon healthcare ecosystem forward will be data. Amazon Web Services is already a Goliath in data management, facilitating countless big-name players in the healthcare industry and opening the door for future collaboration and innovation through its newly launched Healthcare Accelerator. With its impressive analytics capabilities turned toward consumer health habits, some experts believe that Amazon could leverage its data collection through Halo, Alexa, and Amazon Care to push consumers toward healthier decisions. Amazon could suggest food, vitamins, over-the-counter medication, and other related products that could help consumers manage their health. A recent analysis from Huron Consulting Group says, in some cases, these recommendations could be for products the customers don't know they need. Combining remote monitoring, telehealth, prescription drugs, in-person care visits, and preventative products affords Amazon the unique opportunity to build the most robust, all-inclusive, personalized care service that the industry has ever seen. But asking the big question, could it really go and disrupt the entire healthcare system? Fighting healthcare. Still, resources and ambition aren't enough to upset the complicated and ever-changing balance of U.S. healthcare. Amazon has already stumbled along the way. In 2018, the company made major waves by linking with finance behemoths J.P. Morgan Chase and Berkshire Hathaway to launch Haven, a healthcare solutions company that never truly defined its vision. Despite initial fanfare that sent stock prices for legacy healthcare companies tumbling, it quietly sailed through 3 years of executive turnover before closing its doors in early 2021. And while Amazon's lauded data capabilities and analytics insights could be revolutionary, they will also need to be safe and supported by evidence. During the ongoing pandemic, for example, Amazon's search algorithms promoted ivermectin, a deworming drug falsely touted as a cure for COVID-19. When users typed IV in the Amazon search bar, the website recommended the drug and steered users to product pages littered with reviews either incorrectly or sarcastically declaring ivermectin a wonder cure. Amazon soon added a cautionary notice on ivermectin product pages, but it was not the first time during the pandemic that the world's largest store raised eyebrows. Throughout the outbreak, Amazon has battled books and products pushing misinformation that have continued to proliferate on the platform. These missteps have massive implications for patients. At scale, the potential for damage increases. Time will tell whether Amazon is up to the task of delivering safe, effective care in an industry that has a reputation for stonewalling incumbents and would-be disruptors alike. Plus, there is yet another element here. Not everything can be done at home. This may seem obvious, but it needs to be said. It's very true that Amazon could do a well enough job by getting physicians, nurses, doctors, and so on to people at their own homes or deliver things like medicine, prescriptions, vitamins, and so on. That is not in doubt. But if we're talking about the entire healthcare system, you know that it's more than that, right? There are people out there who are going to need certain kinds of treatments that go beyond what can be done safely in a home setting. X-rays, ultrasounds, and of course, surgeries top the list. Any attempt by Amazon to try and deliver those kinds of things to their consumers would likely be dealt with heavy backlash. So, while they could help in certain ways, they would have to capitulate certain other elements to better equipped hospitals and care centers. Plus, cutting corners. While Amazon may be one of the biggest companies in the world, that doesn't mean that they're flawless in their business practices. They've been mistreating their workers for a long time, and every attempt to unionize has been fought tooth and nail because Amazon and their higher-ups don't want to deal with it. So now, imagine that kind of mindset being applied to your healthcare. Doesn't sound that appealing, does it? Exactly. While we may not have to fear Amazon going full tilt, as it were, that doesn't mean that we shouldn't be asking whether we want someone like Amazon going and doing these medical things at all. So, what do you think? What do you think of this look at this Amazon and how their own goals might just go and potentially disrupt healthcare as a whole? Do you think that Amazon might just be making these big moves for their own gain and nothing else? Do you hope that they don't succeed in their plans? Or do you feel we have nothing to worry about? Let us know in the comments below. Be sure to subscribe, and we'll see you next time on the channel.